The second annual conference for health professionals education and training and healthcare by the Ministry of Education and Sports intends to enhance standards among health training institutions for quality productivity. Minister of Education and Sports Janet Kataha Museveni was represented by the State Minister for Transport Fred Byamukama.
Getting good nurses, good health professionals, it is joint efforts. Education Ministry does not do it alone. And they have proved this through the stakeholders. Therefore, you have even those who have invested in education, private partnerships, private schools, and those who have invested in health care. So it is a joint partnership.
The ministry launched a revised training curriculum for a diploma in clinical medicine and community health, targeting to include modern methods of tutoring to fit the technological demands in the prevailing health and education environment.
The curriculum has been replaced, but you know, as the world is advancing both technologically and economically, there are a lot of new things coming in, even the conditions, new conditions coming in. For example, people had never heard of COVID-19, it came up. But there are those who had already the management skills on how to manage it. So if at all these curriculums were not being revised every time and again, now you could find in schools people are teaching things of 1900.
Skills that we are putting in the curriculum now is to allow this clinical officer to be able to monitor his patient or her patient while he's in their villages, but to monitor and see how this patient is doing. People with chronic conditions should not frequent the hospital all the time.
Health practitioners recommend adjustments in the curriculum revision period, as 5 years are considered to be a lot for the demanding sector.
I would think that 5 years are not very few, but depending on what the country grapples with. Because like COVID came in 2 years, but curricula was already there. So you can't say we shall wait for 5 years to review. The emerging issues force you to review your curriculum so that you can meet the standards of the world, and now even with technology.
Stakeholders in the health sector want the Ministry of Health to refocus significant resources towards in-service training for health practitioners.
If he's a midwife, he becomes a traditional birth attendant. So there is need to do in-service training.
Health training schools prioritizing money than required standards are cautioned and face the registration.
And of course that will have an implication on the standards, on the students. But also we have the mandate to withdraw our license or our registration if you are not compliant. Because we don't want you to be a burden to the community. We know very well that if you take in more than what you can afford, the quality will be compromised.
The 2023 Health Professionals Education Training and Healthcare Conference, based on the theme, Enhancing Health Professionals Education and Training to Accelerate Universal Health Coverage in Uganda. Abdul Nasir Lubama and Sulaiman Kagugube for UBC.